So next we'll go to vascular injuries. They can be from the abdominal wall bleeding, so you got to know anatomy of your blood vessels. Then they can be intraperitoneal, depending what you do, like mesenteric ovarian uterine arteries. And then they can be, the worst kind is the retroperitoneal vessels that usually will only happen during the insertion of your trocars. There's one thing, there's no lawyer in the world that can defend you if you put your secondary trocars without direct visualization. So when you have access in the abdomen, always make sure that you see where you're putting the secondary trocars. So there are two blood vessels that you can hit on the abdominal wall. One is inferior epigastric, which is right here, and the other one is superficial. The inferior one you can only see and through the laparoscope, and you will see one artery followed by two veins, and the superficial one you can trans-illuminate. The inferior one you cannot trans-illuminate because it's at the lower part of the abdomen, I mean the inner part of the abdomen. So this is, I'm holding my finger here on the inferior epigastric, and this is the superficial. So you gotta, if you ever get in the situation where you hit those vessels, those bleedings can be quite dramatic. I mean, it's a big bleeding. Then you can either take a largest needle and then tie it under and above, or you can try to put the Foley catheter through the trocar and inflate it and pull it back. It doesn't really work well, never for me. And then you can use nowadays suture passers like cardiotomicin, and you put it underneath and above. So you tie it underneath and above, like in this situation here, and you just cut it next day. They may have huge hematomas, but they should be fine.